Hi, my name is Artemio Pagan, and this is my lab report for Lab 3, Skin and Bone. So, for my references right here, I have my pictures. There's some writing on the back. There's nothing for this class, nothing to refer for anatomy. I have my list of the structures. Again, no writing on here, nothing I can reference, and then my bone model so I can go off the different bones. I'm not in my usual workspace for labs. I'm at work right now, so we're just in a clinical treatment area. But as you can see, there are no references I can use for anatomy. And then one of my co-workers is currently filming. She's not holding any notes or anything for anatomy. So we'll go ahead and start. We're going to start with the skin, and then we'll go from the top of the list down. So first we'll go over the basement membrane. This is going to be kind of between the epidermis and the dermis. It's the connecting tissue right there. Next is the blood vessels, as you can see right here. You got the red for the arteries, blue for the veins. This is in the dermis and the hypodermis. After that, we have the dermis. Dermis is under the epidermis, so it's going to be here and then down, and then it's between the epidermis and the hypodermis. Next on the list, we have the epidermis. It's going to be from here up, and this is above the dermis. The tissue to make up the epidermis is epithelio-squamous or squamous tissues, and then usually the epidermis is more superficial, so it's not going to be as thick as it is in the picture. But for the purposes of this lab, I made it thick like this so it could do more detail. After that, we have the keratinocytes, which are these guys right here. Then we have the melanocytes, which are the epidermis. This little green one right here produces the melanin. And then we have the hypodermis. Hypodermis is under the dermis. The tissue for it are the areolar tissue and the adipose tissue. So you see this is no real structure to distinguish between the dermis and the hypodermis. I just did the line right there for the purposes of the lab. And then you see the blood vessels starting in here, and this yellow part is the fat tissue. After that, we have the papillary layer. This purple right here with a finger-like structure is the top layer of the dermis, and then the connective tissue for that are the areolar tissue. After that is the reticular layer. This is just under the papillary layer. The tissue is more dense, so that's where you get the collagen fibers. Next on the list, we have the stratum basal. This is the bottom layer of the epidermis. Again, this is the epidermis, so it is above the dermis. After that, we have the stratum corneum. This is the top part of the epidermis, so it's the top layer of skin, the most superficial part. It's kind of the peach coloring on here. After that, we have the stratum granulosum. This is the yellow layer right here. This is not directly under the stratum corneum. It's a little bit lower than that. And then we have the stratum lucidum next on the list. If you can tell, the color difference is more like of a bright orange color directly under the stratum corneum. And then we have the stratum spinosum. This is this layer right here where we have the keratinocytes. And then we have the sweat gland on here that I drew. It starts in the dermis. This goes up all the way to the top of the skin. This is where sweat is secreted to help keep the body temperature cool when it starts to heat up. Now we'll move on to the compact bone. So first up, we have the blood vessels again. Again, it's blue for the veins, red for the arteries, and it goes up into the bone, starts here, goes into the central canal, which we'll get to in a second. Next, we have the canaliculi, which I did it like the textbook picture. So we have the spongy bone right here, and then it's kind of zoomed in. So this is not how the bone would actually look, but I just kind of did like the zoom in part, just like the textbook. The canaliculi is these little stripes on within the spongy bone. After that, we have the central canal. Like I said a second ago, this is right where the blood vessels and also the nerve go through. These are within the osteons, which again we'll get to in a second. Next on the list, we have the circumferential lamellae. So these lines are just indicating that circumferential around the bone, and the lamellae is like that free space kind of between the lines. After that, we have the concentric lamellae. So again, this is not around circumferential around the bone, but it is the kind of the free space. This is in the osteon, so it's the free space between within these little circles. So this little blank white part right here. After that, we have the leucinae. Again, this is in the spongy tissue, so it would be right here, the spongy bone, and then it's this little green part indicated on my drawing. After that, we have the nerve. This is right next to the blood vessels in yellow, and again, goes through the central canal. After that is the osteocyte, again, the spongy bone. So as you see here, it is kind of in the middle of this little orange part on here. Then we have the osteon, which I brought up earlier. It's this circle that kind of keeps, this is like the central, where like the canal goes through, and you have like the concentric lamellae going through here. So it's marked by the circle for the osteon. And then we have the periosteum, which I have, this is the outside the bone, so it's kind of peach color right here. Again, not that color in real life, but just makes it easier to annotate on this drawing. So that does it for the compact bone. Next up, we'll go with the different bones. First, we have the cervical vertebrae, which is in the neck right here. There are 7 vertebrae for the cervical vertebrae. After that, we have the diaphragm. No muscles on here, but the diaphragm would be under the rib cage, helps you breathe. So after that, external abdominal oblique muscles is in the abdomen. It's kind of the outside parts of the abdomen, as opposed to like the inside. So it'll be out here. Then we have the frontal bone, which is on the skull. It's going to be around the forehead and kind of goes up just a little bit, but it's mainly the front part of the skull. Next, we have the hyoid. This bone is between the chin and the thyroid. Can't really see it on here, but it'd be right around this area between the chin and thyroid. After that is the lumbar vertebrae. This is also on the back. This is the lower back. There are 7 vertebrae here. Then we have the mandible. This is the jawbone. The maxilla. So the maxilla is like the face bone. The nasal bone is the bone just on top of the nose. The occipital bone is on the skull. It's the back part of the skull. We have the parietal bone, which is on the skull as well. It's the top of the skull. Then we have the rectus abdominis muscle. This is again on the abdomen. This is where your six-pack would be. So as opposed to like the obliques, this is inside. So where your six-pack would be. Then we have the sacrum and the coccyx. The coccyx. So sacrum is here. Coccyx would be the tip right here. Then we have the sphenoid bone. So this is inside the eye socket, so kind of in the back part, inside the eye socket at the back. Then we have the sternocleidomastoid muscle. It's on both sides, lateral side of the neck, so it'll be here to demonstrate on myself. The sternum, so just right here. The thoracic or the temporal bone on the skull. It's on the sides where your temples would be on both sides. Then we have the thoracic vertebrae. This is again on the back, so the thoracic, so it's kind of the chest and the stomach area. There are 12 vertebrae here. And then we have the trapezius muscle. This is on the back, so it's kind of the top of the back, at the base of the neck, connected between the shoulder blades. Then we have the zygomatic bone, which are the sides of the eye socket right here. And that's all the bones we have in here, and that completes this lab report.